Welcome back. Again, my name is Kim Coleman, and as we were planning this symposium in early 2020, we had no way to predict that this national pandemic would completely change the way we live our lives. During this session, you will hear the impact of COVID-19, specifically on individuals in treatment and recovery, and what folks on the front lines are doing to combat these struggles. Unfortunately, due to some other very pressing commitments, Secretary Rachel Levine could not be with us today. Instead, it is my pleasure to introduce Magna Patel, who is the Deputy Secretary for Health Resources and Services at the Pennsylvania Department of Health. Dr. Dale Katzker is the CEO for Cadenza, Inc. Mike Krafket is a certified recovery specialist and a CRS supervisor at Armstrong, Indiana Drug and Alcohol Commission. And Paul Circa is the regional outreach manager for Dream Life Recovery. Thank you all for being here today.
Okay.
Magna,
Seems like you all can hear me, but I cannot hear any sound here. So I'll just go ahead and kick off here without wasting any further due time. Good morning. My name is Magna Patel, and I'm the Deputy Secretary for Health Resources and Services at the Pennsylvania Department of Health. Secretary Levine was unable to join today morning, but I'm pleased to have the opportunity to join this discussion and update on her behalf. First of all, I hope that all of you and your respective families are doing well and staying safe. COVID-19 pandemic has changed our lives in many ways. Today in Pennsylvania, we reported a total of 375,431 cases of COVID-19, and we've tragically seen over 10,757 deaths due to COVID-19. We've seen and we continue to see an upward trend of increases in cases and deaths. The trend in the 14-day average of number of hospitalized patients per day have also increased by over 3,300 since the end of September. The 7-day rolling percent positivity of COVID-19 tests in Pennsylvania is about 29%. Best practices recommend 5% or lower for at least 14 days. So the department cannot emphasize enough that COVID-19 cases are at an all-time high. There are simple measures that each and every one of us can take to stop the spread. Wear a mask, maintain 6 feet or more distance, wash hands, clean up surfaces often, and download the COVID Alert PA mobile app. But for millions of people, COVID-19 is not the only health threat. We're literally in a colliding storm of the global pandemic in midst of an ongoing synthetic opioids and stimulant-related epidemic. The threat of COVID-19 has essentially intensified the healthcare disparities driven by all the social and economic factors that place certain groups and individuals at increased risk for both substance use disorder as well as risk and adverse outcomes from COVID-19. In Pennsylvania, we just renewed our opioid disaster declaration for the 12th time. There's no doubt that COVID-19 has caused unprecedented challenges to the delivery of healthcare for patients with substance use disorder. The economic instability, social isolation, and increased rates of depression and anxiety caused by the pandemic has led to an increased risk of substance misuse and overdoses. At the same time, we've seen that misuse of prescription stimulants and the abuse of illicit stimulants, such as the cocaine and methamphetamine, continue to rise in the US. In Pennsylvania, we've seen success reducing the opioid-related overdoses between 2017 and 2019. But overdose deaths involving stimulants without the presence of an opioid have increased steadily from 2017 to 2019. Preliminary data shows that there have been more stimulant-related overdose deaths each month from January to May of 2020 when we compare the same statistics with 2019. So in terms of treatment, lockdowns, social distancing, and quarantine measures imposed to mitigate COVID-19, combined with the long-standing stigma towards substance use disorder, have caused increased barriers to access the substance use disorder treatment. So even prior to COVID-19, the need for a comprehensive guidance on treatment of stimulant use disorder was apparent due to the rising stimulant use and increase of stimulant misuse. And the SAMHSA's newly released evidence-based guideline on treatment of stimulants use disorder is certainly very resourceful to practitioners. So here in Commonwealth and through the several federal waivers, I wanted to highlight a few things that we have done in response to help with substance use disorder treatment during the COVID-19. So we have relaxed our regulations on telehealth and outpatient drug and alcohol services. DEA has adopted policies to allow practitioners to prescribe controlled substances without having to interact in person with the patients. We've written consent to disclose patient information around SUD during this disaster declaration, and SAMHSA has allowed opioid treatment providers a greater flexibility around providing take-home medications during this pandemic. As always, our Pennsylvania's Get Help Now resources are pushed out as public service announcements, so there's more visibility on these resources. And we continue to have our mental health and emotional support toll-free lines available. So finally, there's no doubt there's so much work to do. We all need to unite our efforts across the Commonwealth and help curb the surge in opioid and stimulant overdoses. We need to help our patients suffering from substance use disorder and ensure that they have greater access to quality care. So without further ado, I'd like to turn my mic back to the moderator for the next presentation and discussions. Thank you, everyone, and stay safe.
Thank you very much, Deputy Secretary Patel. Our next speaker will be Dr. Dale Katzker.
So this is, again, as Kim just indicated, I'm Dale Klatzker. I'm the president and CEO of Cadenza. And I guess in the next few minutes, I'm going to try to weave together the provider perspective of this epidemic, and at least in Cadenza's case, what we're doing and what we've been doing to try to weather this storm. Next slide, please. So this is our mission. I won't read it word for word for you, but basically it's similar to most of the other provider organizations in Pennsylvania. What I would highlight for you is that we look at all aspects of the individual and that we provide a continuum of care, and one that is a partnership with our client or patient in terms of what the outcomes look like. Next slide, please. So what is the perfect storm? And I'm getting tired of using the word perfect storm, but I guess until we come up with something better, it's what we have. This is the collision of an addiction epidemic, not just an opioid epidemic, and the coronavirus. And it's complicated by all the factors that we are all living through. We have heard and know that there is increasing stimulant and polysubstance use during this period of time. It's been growing. You've heard all the statistics, and it is creeping up rapidly here in Pennsylvania. We know that isolation is not a friend of those with an addiction. We know that isolation is not a friend of those with depression. It exacerbates all of those issues. People have not sought care to the degree that they need it or that it was available for lots and lots of reasons. But, you know, this has left what I would consider to be a pent-up demand that, God willing, once we have a vaccine and it's widely distributed, we are going to have a tsunami of need flood into the community. We know there's a recession. We know there's high unemployment, increasing unemployment. There are competing budget priorities. So the state budget, while basically stable right now, is going to have to continue to weather this storm with both change in federal leadership. It seems like we're printing money to solve current issues, or trying to solve current issues, local issues, state issues. So, these are all confluence of issues that are adding to the problem. We have had at Cadenza, we averaged for many years probably 80 to 85% of our occupancy of our residential programs and our outpatient. During the height of COVID, it has dropped to about 55 or 60%. That has made it very challenging to keep our doors open when we are reimbursed as other providers are on a fee-for-service model. So how do you stay open? How do you keep the doors open, knowing that there will be a tsunami on the other end of need? How do you pay people? How do you keep people healthy? How do you acquire PPE? How are we going to acquire vaccines? These are all issues that keep me up at night. We are all fatigued. We are all, overwhelmed and exhausted. So what's going to happen as we go forward? What is this going to look like? What's the treatment capacity going to be on the other end of this? Providers are buckling under this pressure. And, I've seen and heard of many providers who have closed their doors. So to the extent that we can, we need to preserve existing treatment infrastructure while we envision what comes after the pandemic. Next slide, please. These are some statistics that I'm not going to bore you with because we've talked about them, but these are specific to Pennsylvania, and they're consistent with what you've already heard, that while it appeared that we had the overdose numbers under control and decreasing, we know that the stimulant-related, opiate and amphetamine-related, polysubstance use-related hospitalizations and overdoses are increasing. And they're increasing dramatically in some parts of the state, and they are of a nature that we really need to pay attention to them. Next slide, please. So what do we know? Well, we have a tendency as an industry to look for and come up with the quick answer or the silver bullet. And so substance misuse treatment has been dominated by the opioid use disorder. What you've heard and what we know is that standard treatment doesn't work for polysubstance users and stimulant users. So we've had a MAT model. We've had a prior and during residential care and sometimes abstinence-based outcome model. As these things continue to rise, they are going to challenge our either-or world. It's not MAT. It's not residential. It's all of the above plus. An analogy might be this platform we're on. This Adobe platform is probably the 6th different platform I've been on. So, Zoom and Team and everything else. We don't have a standard. We don't pick one thing to work off of. We have multiple approaches. And in a period of crisis and people being overwhelmed and adding on to that all the other factors in people's lives, the social determinants of health, this complicates everyone's challenge to keep the doors open and keep moving forward. Next slide, please. So how do we innovate? How do we address emerging treatment needs in an environment where there is resources are limited and where we're shifting from saving lives as a provider group to saving ourselves, individuals as well. Next slide, please. So first, we must address and break down some of the siloed assumptions that we all have. Providers may assume that the state's going to be the hero and provide the funding necessary and needed to sustain and expand treatment. The states may assume that the providers will be the hero and continue to engage and treat clients at the current amount of revenue that they have under the current conditions. And basically both are wrong. There is no superhero here. There is no way that any one group is going to come and save the day. We have to work together. And we have to work together because we know the future, if we don't work together, is going to be worse than the present. So we have a collective survival focus that we need to look at. We need to maintain our existing capacity. We need to preserve the resources, the infrastructure, the network of providers that exist out there now. And sadly, having done this for a really long time, what you see happening is instead of people lining up together, we circle the wagons and shoot at each other. It should be this or that. It should be more of one and less of the other. And I would suggest that that's not the right way to go about doing this. Next slide, please. What's Cadenza doing? Well, this is my coming out ball, I guess, or my debutante ball to the state. We have new leadership at Cadenza. I've been here about a year and a half. I've brought in a new team. And we are making the changes that we believe necessary to not only improve the quality of our care, but to be here in the long term, surviving beyond the COVID epidemic so that we can meet community needs and client needs. We are moving away from an abstinence-based long-term residential treatment provider mode to a more dynamic partner and provider of evidence-based treatment services across a full continuum of care. And COVID has been challenging. It's been challenging to operations. It's been challenging to morale. It's been challenging on every level. But we need to remain future-oriented. In addition to weathering the storm, we need to be equally prepared for when the storm subsides. Next slide, please. How does this tie into stimulant issues? Well, with our good friends and partners at the Bucks County Drug and Alcohol Division, Cadenza has just recently implemented a new treatment track in our lower Bucks programs for those affected by stimulant use disorders. It's based heavily on the matrix model that we heard about earlier, but it incorporates kind of an adaptation of that using not only contingency management, but a program called Motivational Incentives for Enhancing Drug Abuse Recovery, and other positive reinforcements. The inclusion of community reinforcement strategies with these kinds of functional analyses, exercise, community skills, social determinants, training our workforce, productive leisure. These are all things that we're going to attend to in this program and hopefully be successful. We're well situated for this in Lower Bucks because we are adjacent to a hospital with an emergency room, where in our program itself, we have a kind of a small continuum of care with a detox, short-term residential, and longer-term residential. So these are all issues that we are facing. In crisis, there can be opportunity. And we want to be there, and we hope other providers are there to work collaboratively to address the greater issues. Thank you.
Thank you, Dr. Katzker. Our next speaker will be Mike Kraft.
Thank you. My name's Mike Traffic. I'm a certified recovery specialist and the CRS supervisor with the Armstrong Indiana Clarion Drug and Alcohol Commission. Also a person in long-term recovery. This past April, I celebrated 12 years of recovery, struggled with addiction throughout most of my adolescent and adult life. And then in 2008, I went to treatment for the final time, and I stayed engaged in treatment for about a year and a half during that last, and which was my 9th attempt at going to treatment. And I tell you that because it really compares to, or is very different from, my first experience in treatment, where my first stay was only 10 days, including detox and a stay in residential. And as you can imagine, the success I had in that first attempt was not that great. So I'm a firm believer in treatment and getting people connected to community resources and supports. And in 2010, I started working at the Armstrong Indiana Clarion Drug and Alcohol Commission as a certified recovery specialist. So working at the Drug and Alcohol Commission has allowed me to help individuals in early recovery get connected to their local recovery community, get connected to resources in the local area, and help them bridge the gap between treatment and long-term recovery. At the Drug and Alcohol Commission, we have 8 full-time certified recovery specialists that work with individuals all throughout the continuum of care, whether they are just going to withdrawal management for the first time and they're unsure about what to expect at treatment. They just need to talk to somebody who's been through that experience, or they're coming out of a long-term stay in residential or a halfway house and trying to reintegrate back into their home community. It's our job as recovery specialists to connect them with resources to help them be successful and remove any barriers between them and long-term recovery. And I know for me that was particularly important, especially early on, was getting connected and embedded within my local recovery community, meeting people that were in recovery, that were successful in recovery and thriving and doing well, to model what I was going to do after what they were doing. And I think, as we heard this morning, there's a whole host of challenges for individuals today dealing with and trying to build and foster those connections. So we've tried to be innovative and take different approaches to how we keep people connected and get them the supports that they need throughout their experience in early recovery. I know with some of our recovery support services that we provide, we started a warm handoff program in 2015 in the hospitals in our 3 counties. And our goal for that, because it was in the peak of the opioid overdose epidemic, was to get overdose survivors connected to treatment. What we quickly learned was that a good percentage of the population that we were seeing and getting referrals for were not just people using opioids. We were seeing an increase in stimulant use, both cocaine and methamphetamines, as well as alcohol and polysubstance use. So we were getting a variety of substances that people were using and showing up in the hospital. So it wasn't just opioids, even though at that time, what the focus was on and what we heard most about was opioid use disorder. So trying to get individuals not only connected to treatment, but like I said, get them connected to the resources that are going to help them be successful in their recovery long term and maintaining that relationship on an ongoing basis. For some, it may be, a few appointments to get them connected with what they need, and then they're successful and thriving on their own. And for others, we maintain that recovery support relationship longer term, a year, 2 years out, staying connected with that individual. Dr. Rawson hit on something in his presentation this morning that I thought was particularly interesting when talking about recovery from stimulant use disorder. Talked about the benefits of exercise, and why that really stood out to me is one of our recovery specialists recently, within about the last 18 months, started a fitness-based recovery support group called Recovery in Motion. We partnered with one of the local YMCAs to offer fitness-based recovery groups. They occur 3 times a week, and the idea is to get people in recovery together to start focusing on their overall health and wellness, to introduce them to new ways to exercise and to do that together in a group setting. Obviously, in March and April, we had the transition to doing that remotely. So we started doing that via Zoom. My staff would record and put up and use Facebook Live to keep people engaged in that process. And later on throughout the summer, we're able to come back together and do that in person. And unfortunately, as of recently, we've had to move back to doing those via Zoom. But what we've seen during that time is a group of people that have really engaged in that activity, and that have made that a core part of their recovery. We're getting a lot of really good feedback about some of the outcomes since they started participating in Recovery in Motion. So we're really excited about that and want to keep that going as much as we can, or as long as possible. Some of the challenges that I think individuals with stimulant use disorder in particular tend to face, particularly in early recovery, we're talked about earlier this morning, depression and anxiety in particular in early recovery are things some of the folks that we're working with are dealing with. On top of that, isolation. I know when I went to treatment, they told me change people, places, and things. Do not associate or hang out, spend time with people that are using drugs. But unfortunately, that was all that I knew. So I had to either isolate or get connected to some new supports. So that's one of our focuses, is trying to help people, counter that isolation. And we've had to get creative now with this pandemic in how we do that. Also, what was talked about earlier is no widely used medication for recovery from stimulants. I know in working with individuals with opioid use disorder or alcohol, there have been other therapies or medications that can be used to alleviate some of the symptoms and struggles that people are dealing with. I know there have been some breakthroughs or some things that treatment centers or providers have used to help alleviate some of those symptoms. But that's one of the things that I think I see most with some of our clients. It's just that struggle, in particular, that first 6 months of recovery, to where they're fighting off that depression and anxiety, that lack of energy. That's why, in particular, I'm a firm believer in those exercise groups and getting people not only connected, but physically active, because I know for myself personally, I saw some real benefits to that of physical activity and how that impacted my recovery. Bear with me one second. I apologize for the dog barking. Adjusting to working from home. So in trying to wrap this up, again, using my personal experience with addiction and in recovery to benefit others, I think has been one of the key things that we try to do with our recovery support services program, and sharing with others not only that there is hope that they can and will recover, but talking about strategies and ways to do that successfully, I think is particularly important. And in this very difficult time during the pandemic, having somebody that you can reach out to. One thing that we've tried to do over the past 3 years is expand our hours of availability, which was particularly important because, as we all know, people may decide that they want to start their recovery process on a Saturday or a Sunday, or outside of the hours of Monday through Friday, 8 to 4. So we've really expanded our availability for services. They can get in contact with a recovery specialist 24 hours a day, 7 days a week. And I think since expanding that and adding those additional hours, we've seen increased engagement and increased ability to work with people throughout their recovery process and get them connected to what they need. So I thank you all for joining us at this conference today. I'm looking forward to participating in the rest of the breakouts. And I'd be happy to answer questions that anybody had.
Thank you, Mr. Krafik, on that perspective. And our next speaker will be Paul Cursor.
Good morning, everybody. My name is Paul Kersey, and I'm an outreach manager for an inpatient facility on the western side of the state of PA. A few months ago, a friend of mine reached out and asked me if I would want to be a part of this to talk about the impact COVID has had on the recovery and treatment community. A lot of the speakers that have gone before me have covered the stimulant aspect in great detail. So more so as a person in long-term recovery and somebody that works in the field and gets to see from a firsthand point of view what it looks like out there. I wanted to talk about some of the things that people may be suffering from right now, some of the ways that we may be able to help combat that. I can't see a single thing about the treatment community that is the same that it was a year ago today, whether it be access to outpatient or inpatient care, whether it be in-person meetings, whether it be being able to meet with the fellowship community in an outside space, either before or after the meeting. And it's cut for me personally, based on the experience that I'll share. I don't know if I would be where I am today had I been forced to do it the way that they are now. So a little bit about myself. In 2011, after a pretty brutal battle with opiates, I ended up in a small meeting room in Bel Air, Maryland, at the end of what seemed to a new guy a 10-mile driveway. And at the end of that driveway were the happiest group of people I've ever seen in my life. And it was a look on the face that was unfamiliar to me. And I walked up the driveway, and they were essentially waiting for me, but they knew who I was, and they knew my story, and they knew what I had been through, and they wanted to share their experience with me, and they did it day in and day out. They picked me up for the meeting. They picked me up early. They took me home late. They made sure that I wasn't by myself, that I wasn't in a bad area, in a bad headspace. They made sure that I wasn't upset, depressed, that I learned how to laugh, how to smile. They carried me when I could not stand on my own. And I give a lot of credit to those men and women for who I am today and the way that I treat other people today. And people coming out of treatment today don't have that. People coming out of treatment today are given a link to a meeting that they can participate in, and they can hear the message, don't get me wrong, but I don't get to see somebody in a Zoom meeting staring down at their feet, clearly uncomfortable and clearly struggling with every aspect of life. I don't get to ask that person if they're okay. I don't get to invite that person out to coffee. I don't get to check in on that person on a consistent basis. There's no personal connection there. It's it's as personal a connection as this conference is today. So that just gives you an idea of what it's like. And I can say, I've found it from a treatment aspect. We've found it very difficult to interact with people that come in contact with individuals that need help. Office spaces being closed, the inability to do drop-offs or drop-ins, Being blasted with emails and marketing material on a consistent basis makes people that are in the field and work with men and women that need help kind of standoffish to strangers that reach out to them that, that want to interact or want to set up a meeting. So, from a marketing standpoint, also, it's incredibly difficult to connect with people who find themselves in front of individuals that need help. I field a lot of calls from psychology today, and one of the number one issues that I see today is that people aren't getting calls back, or the emails aren't being responded to, or they're looking for private therapies or individual help, and they can't seem to access it. Solution-wise, or in an attempt to combat that, I think that I myself need to do a better job of connecting with individuals on a more personal level. I think that I need to make myself more available on social platforms for individuals that need somebody to talk to, so that they know that they can reach out to somebody like me. And I think I need to do a better job. I think as a whole we could do a better job in that area, because COVID has essentially forced people into dealing with everything they were told to avoid at the same time. Stay in your house, don't go out, don't interact with other people, wear a mask, don't talk to anybody, don't get too close. There's a number of things that in early recovery you were instructed to do that COVID has ended up telling you to do the complete opposite. And it's got to be tough. It's got to be tough for individuals that find themselves stuck inside or outside of people that already suffer. Let's just say 9 months ago, you didn't see you had a problem with alcohol. You didn't see you had a problem with alcohol, or opiates or stimulants for that matter. Let's just say you found yourself to be a completely normal person. There has been a rise in individuals that didn't know how to deal with the socioeconomic issues, the financial hardships, the job loss, the unemployment, the stress of not knowing how bills were going to get paid, the forced isolation that they weren't used to. Like, this isn't a matter of people that are just getting out of treatment. This is also introducing an entire new population of people to relying on substances, whether they be alcohol or drugs, to get them through the day. So when we talk about what happens when the world opens back up again, we have to also consider what we're going to do with a completely new population of people that don't have any experience with recovery or treatment, and also don't have any experience or expectations as it relates to whether or not they were ever going to become somebody that struggled. Just like everybody else, if you have any questions or want to know more, please feel free to reach out. And that's all I have. Thank you.
I'd like to thank all of our presenters for the Weathering the Storm session. Very insightful information. Now it is about 5:11. I want to remind the audience that the links to the breakout sessions are on their screen. If anyone is having technical issues, I know there have been individuals raising their hand. We aren't entertaining any questions during the plenary sessions because there are so many people on the plenary sessions, but we are taking questions through the resource account, or there's a lot of things happening behind the scenes so that if there are any issues, we can address them. So folks can now start to exit to their breakout sessions, and we will resume the plenary back here later this afternoon.